Yeah, sweet. So I think we're rolling. We're all good to go.
Yeah,
all
go
right,
for
sweet.
it.
Welcome on, Corey Feist, Wave of One podcast. Wonderful to have you on, man.
Thanks for having me.
How you doing today? Everything good?
I'm doing great. It's
Sweet.
great to be with you today.
Yes, sir. Thank you so much for coming out and giving us your time. I know you're on vacation, so might have been a burden to get you out here, but
no worries at all. It's a pleasure.
Something I wanted to start off by asking was, personally and emotionally, why did you decide to start the foundation you did?
So I started the Dr. Lorna Breen Heroes Foundation in the summer of 2020. And I did that after a whole career in healthcare. And during my career in healthcare, I had worked on the legal side of the business and on the leadership and executive side of the business. And what I heard during that time was increased amount of stress among the doctors, the nurses, and everybody about all of the time they were having to spend away from patient care. And so I worked really hard to try to make the day-to-day living experience and working experience for the workforce that I worked with, which was at the University of Virginia Health System in Charlottesville, Virginia, better. In the spring of 2020, my sister-in-law, Dr. Lorna Breen, who was an emergency medicine doctor in New York City, took her own life after a very short stint with COVID, where she contracted COVID and then went back way too soon to try to take care of patients. Lorna was very worried that because she was overwhelmed, that she would be seen as weak in the healthcare industry. Needing to take a break was something that was a sign of weakness. And so she didn't take a break. And what she did was she drove herself to a point of needing emergency mental health treatment for the first time in her whole life. And when we obtained that mental health treatment for her, she then started to tell us that now that she'd obtained mental health care, as a doctor in the United States, she would lose her ability to work. She would lose both her state license and she would lose what's called your hospital credentials, which is your ability to work in a hospital.
Wow.
And so, as a lawyer from healthcare, I was shocked to hear that in 2020, doctors and nurses and other healthcare professionals were really concerned about A, taking care of themselves, and B, that there would be repercussions on their job if they did anything about it. And so after Lorna took her life on April 26, 2020, there was a huge amount of national publicity that our family didn't want. But what that national publicity really created were really two important things in retrospect. The first was we heard from thousands and thousands of healthcare workers and the family members of those workers who had similar concerns to Lorna. And then second, we received a phone call from our U.S. Senator Tim Kaine, who saw parallels between what his son was experiencing in the U.S. Marine Corps and the infrastructure that the Marines had created and the armed services had created to support the mental health of soldiers. And he simply asked the question, does a similar infrastructure exist in healthcare? Because I see huge parallels there. And when I pointed out to him that didn't exist, he and his team went about introducing the first federal law creating that infrastructure called the Dr. Lorna Breen Healthcare Provider Protection Act, which we can talk about later. But it was really the feedback that we heard from healthcare workers, coupled with my experience in the healthcare industry, that drove my wife, Jennifer, and I to co-found the Dr. Lorna Breen Heroes Foundation just a few months after my sister-in-law died. We never intended on creating anything after she died. We just listened intently to the feedback that we were hearing and felt strongly that we couldn't ignore that feedback and that somebody needed to raise their hand and say, I see you, I hear you, healthcare workers, we are here to support you. And that's what we do at the Dr. Lorna Breen Heroes Foundation.
Gosh, I'm so sorry for your loss, but that is beautiful what you guys did.
Thank you.
So this is 2020 COVID time. So obviously there's probably so much stress on doctors all over America. Just I've heard the hospitals are getting flooded, they're putting tents outside. And so prior to that, you couldn't say you're a doctor, you're stressed out, everything, you couldn't go like see a therapist or something to talk about it without the risk of possibly losing your license to practice.
Yeah, and it's not just doctors, it's nurses, it's pharmacists. And the root of it is that they are asked these questions when they apply to get licensed to work in a state, or they apply to work in a hospital, that ask them inappropriately about if they've ever been treated for a mental health condition. They're often right next to questions about convictions for felonies and like pedophilia.
Wow.
That's not an exaggeration. That's from an actual application. And so what that does is it reinforces what I would call structural stigma, or institutionalized stigma is a better phrase for it, where there's this general cultural stigma around getting mental health treatment in the healthcare industry. And that general cultural stigma is reinforced by these questions that they're asked. And healthcare workers are very aware that they're being asked these questions. And for most people who are not inside healthcare, or those who are even like me, who worked over 2 decades in healthcare, but was never a clinician, and I never had to fill those forms out myself.
Yeah.
I was completely unaware that this is hidden in plain sight for the rest of the world. The good news about it, if there is good news about it, is that we're fixing it at the Dr. Lorna Breen Heroes Foundation, so much so that now 1.5 million health workers in the United States no longer need to worry about those questions, because we've intervened with our national partners to change the landscape. And so that's the good news. It's a fixable problem. The bad news is there's like 6,000 hospitals in the United States, and we've changed it in about 10% of those hospitals.
Okay. And so you're working to hopefully get all of them on the same page soon.
Yes.
What are some steps that you guys are going to take with the foundation to get to that level, to hopefully one day every single health provider worker doesn't have to worry about those questions?
It's a great question. So we have kind of 2 national campaigns that we're working on. One is called All In for Mental Health. And All In for Mental Health is premised on the concept that patients have the right to get mental health care. Health workers do too. And what All In for Mental Health does is it identifies 6 different actions that organizations should take to support the mental health of health workers. Well, one of those actions is confidential access to mental health care. And so that action we've been working on independent of this national All In for Mental Health campaign for a couple years now with great success. We call that one action the All In Champions Challenge for Licensing and Credentialing. And what we do is we give free resources to hospitals or licensing boards so that they can take a look at what they're asking and change it. And then when they do that, we evaluate it against national best practices. And if they've made the changes accurately, we immediately give them a badge, which is called the All In Champions Challenge badge. And if they haven't made the changes correctly, then we provide assistance to them to help them get through the process. We've now awarded badges to over 50 licensing boards in the United States, from dentistry to pharmacy to physicians to nurses, and over 10% of the hospitals in the United States, about 650 hospitals in the United States. So that all in, we have now created benefits, if you will, for 1.5 million health workers. What's important for me to be on your podcast is just an example, though, is that I can guarantee you that 1.5 million health workers don't know that the rules have changed. And that's partly because healthcare professionals are trained, or it's reinforced from the time they apply to school to the time they apply to their first job, that they shouldn't answer questions about this. And so because there are going to be penalties.
And this is throughout schooling and everything.
It's
They're
the whole
just
thing.
like trained not to ask questions.
They're trained not to answer any questions. Don't talk about your mental health.
Yeah.
And so we have to educate them now that it's safe and it's okay. And so they can get mental health treatment. You know, about 2.5 years ago, an organization called the American Hospital Association published its first ever suicide prevention kit. And it looked at suicides among healthcare professionals in the country and identified 3 what they called key drivers of suicide. And this is the very first one that they identified, which is this stigma and the concerns around losing your hospital credentials or your license. And so we know that this issue, when we do this and we make these changes and we communicate these changes, will be life-saving for healthcare professionals. And it's also super beneficial for family members. And I'll just briefly go into that. I received a phone call recently from a family member of a healthcare professional in the United States. And that family member was very concerned that there would be ramifications for this doctor. And I said, well, give me the names of the hospitals that the doctor works. And I looked them up, and those hospitals were on our national maps that we publish on the website, drlornabreen.org, that show where we've given badges out. And I was able to say, your sibling is fine in this hospital and this hospital. And oh, by the way, your sibling's license at that state, totally fine as well. So this tool that we've created and this national recognition program through the Champions Challenge for Licensing and Credentialing and this umbrella campaign, All In for Mental Health, will help to not only change the landscape, but also educate healthcare professionals, their families, and their friends about what the rules are. Because as I said, patients are entitled to healthcare and mental health care. So should health workers.
Exactly. So something I wanted to ask was what were the legalities behind changing this stuff? Like, did you guys have to get anything through Congress or any bills actually passed?
So one of the things about this particular issue is that this particular issue is already covered by the federal law called the Americans with Disabilities Act. And the Americans with Disabilities Act protects people when they're applying for jobs who have disabilities. And mental health care is a mental health diagnosis is a disability in the United States. And so they're protected. So in some ways, what's happening is that you've got thousands and thousands of hospitals and potentially even licensing boards that are running afoul of the law that's currently there. Now, I mentioned before the Dr. Lorna Breen Healthcare Provider Protection Act, which was Congress and the United States' first effort to support the mental health of healthcare workers. And within one of the campaigns that law created, which was a campaign to train healthcare leaders about how to do this how to redesign this coal mine, if you will, as opposed to asking the canaries to be stronger in the coal mine, let's change the coal mine. In the Dr. Lorna Breen Healthcare Provider Protection Act, it encourages organizations to make these changes following the Lorna Breen Foundation's toolkit and get that recognition. So it's kind of now hit in two different places. You had the Americans with Disabilities Act the whole time. You have the Lorna Breen Act now, which is showing organizations how to fix it and directing them to resources on how to fix it.
And you said 650 hospitals now have badges. What do you mean by badges? Like they're certified, they know how to train, tell the doctors, the nurses, everyone in the hospital that they're allowed to, if something's up, you can go talk to someone. You need to figure this out. You need to, because that is messed up telling, doctor or nurse, like, hey, you just need to be stronger, lock in, like be better as a person. Like, I mean, they see so much messed up stuff. I can't imagine, and they just have to go home and act like nothing's going on with this like being scared of possibly losing your hospital credentials or your license. I mean, if that happens, you're out of work. How do you even come back from that?
You just hit the nail on the head. So think about this for a second. In the United States, the average debt that a medical student is coming out from medical school is well into the 6 digits. It's about, I think last time I saw it was like $350,000.
That's a lot of money.
It's a huge amount.
Yeah.
And you've got 4 years of undergraduate school, 4 years of medical school, and then whatever your residency is, which is somewhere between 3 and probably 6 years. So think about, you've got, over 10 years invested in becoming a doctor, plus $350,000. And a message your whole time then you're being trained that you just need to be stronger. You need to be stronger. And you need to ignore the mental health, your own mental health needs, because you're all about patients, right?
Yeah.
So if you think about the risk that a healthcare worker has, which you're getting at, it's like, if I do anything about myself, then I could put at jeopardy my whole career, my ability to pay off all this debt. I'll lose my house. I'll lose, blah. It's very easy and reasonable for a healthcare professional in the United States to say, I'm not going to get mental health treatment because the risk is too great. The reality is we know that if someone is in treatment, they're going to be much better at their family life, their job life, all of the things, everything, right?
Gets better.
And so what we need to do is we need to change that paradigm, and that's effectively what we're doing. So you asked me, what is this badge? So our foundation, the Dr. Lorna Breen Heroes Foundation, has created this national badge. It is literally a sticker that we give out to hospitals. And on our website at drlornabreen.org, under the Remove Barriers section, there are these maps of the country, and they are interactive for people to look at, and they can see if you're a doctor, which states are favorable for these questions and which states haven't gotten our badge yet. If you're a nurse, same thing. If you're a dentist, the same thing. If you're a pharmacist, the same thing. And then there's another layer deeper in the maps, which are maps that show which hospitals we've able to recognize. When we recognize them and we give them the badge, which comes at no cost to them, we also give them a communication toolkit. We give them all of the reasons and examples, not reasons. We give them all of the examples of how they can make sure that their workers know what the rules have been. And so when we give the badge out, the very first year, well, every year has a date on it. And the very first year we give the badge out for just making the changes. If the organization wants the badge again in subsequent years, they need to demonstrate to us how they've communicated it to their workforce. And we're seeing great examples of it. And frankly, it's not that complicated, right? Yeah. It's a matter of just baking this communication into all of the ways that they're talking to their workforce already, and emphasizing that, yes, it's now safe to get mental health treatment. And then, oh, by the way, here are our resources if you want to get access to them. And it's pretty simple. And as I said before, if we understand that this is tied to suicide, if we understand this is tied to people not getting care for very treatable mental health conditions, this is not just going to save the life of the health workers, but it's also going to save, patients from, harm that can happen when somebody is impaired and not getting treatment. Yeah.
So, wow. I mean, because I can't imagine how much different they would perform and how easy it is. I mean, it's so straightforward. You guys give this hospital the badge, you show them the resources, how to help people in the hospital. And it's that straight up. It's just literally you do that. And so that's cool. So if they want to do that again, say 6 years later or something, then they kind of just show you guys how they've been doing it. I can't imagine how many people it's already helped. I mean, 650 hospitals is a lot of hospitals.
That's right. And over 50 licensing boards. Right now, we've calculated at about 1.5 million people it's already helping.
So is this nationwide, or is this, and so throughout those 650 hospitals, there's probably one in at least each state?
You would be surprised how many states it covers.
Yeah.
And there are some states we haven't recognized. Actually, that's not, I was going to say we're sitting here in Florida. We have recognized Florida hospitals. There are still a handful of states that we've not recognized yet. We're helped a little bit by the fact that in the United States, there are some large health systems that have hospitals in every state.
Yeah.
And they have one set of questions, regardless of which hospital.
Gotcha.
And so we've been able to go to those organizations. Since we're in Florida, HCA is a big Florida hospital system.
Is that the Cleveland Clinic, or
that's different?
That's
Cleveland
different.
Clinic is.
They're pretty big as well too, right?
They are. The Cleveland Clinic is based in Cleveland, Ohio, and they don't have a ton of hospitals, but HCA is the largest hospital system in the United States.
Okay.
And they have huge amount of Texas hospitals, huge amount of Florida hospitals. It goes coast to coast.
Yeah.
So we worked with HCA, which completely saw the need to do this and did it very, very quickly. And that's the other thing about all of these things. What you'll learn about big complex systems like healthcare, sometimes it's really slow to change. This has been one of the fastest changing things in healthcare.
5 years ago, you guys started. That's pretty crazy how big you guys grown it just in 5 years.
Yeah.
And so the Dr. Lorna Breen Foundation Act actually got you recognized by the President of the United States, Joe Biden, at the time in 2022.
Yeah.
How was that? I mean, you got to go into the Oval Office. I mean, that was probably a huge like monument for the foundation, right?
It was pretty amazing. So the Dr. Lorna Breen Healthcare Provider Protection Act was originally introduced by Senator Kaine and Senator Young from Indiana in the summer of 2020. Now, what most people will tell you is if you're trying to pass new laws at the federal level, it can take between 8, 10, 20 years to get that law signed in both the House and the Senate and signed off by the president.
Yeah.
We did it in under 24 months.
Wow.
And one of the reasons we did that was because we wanted to make the law a starting point to build upon. So we weren't trying to solve all of the problems in healthcare. We were trying to begin to change the conversation. And we did it in a way that recognized all types of healthcare workers, not just one subset. Yeah. And in healthcare, one of the things that happens is it becomes very siloed between doctors and nurses and dentists and pharmacists when it doesn't necessarily need to be all the time. And this is one of those cases where Congress did this in what I would refer to as an interdisciplinary way. So they recognize that all health workers have some very common needs. Let's build the Lorna Breen Act in a way that benefits all health workers. And so we didn't, and so strategy-wise, Senator Kaine and Senator Young, who are very bipartisan, recognized that we needed to do this with both Republicans and Democrats.
Get everyone involved.
Get everybody involved. And then because it recognized and benefited all health workers, we got a huge amount of different professional organizations that represent those separate health workers supporting of it. We have a national coalition, which we call All In Wellbeing First for Healthcare, which has 35 of the largest healthcare organizations in the country, like the American Medical Association, the American Nursing Association, the American Hospital Association, and many, many others. And those groups all came together and they said, we need to support our health workers now more than ever. Another organization that really helped get this done was a pharmaceutical company called Johnson & Johnson. And they have a part of their mission statement or credo is to take care of those who take care of patients.
Yeah.
And the Johnson & Johnson team donated its lobbyists, its professional lobbyists to say, we have to get this fixed. And so we made this huge push. We got both Republicans and Democrats included. We got all these different arms of healthcare, and we got it through so that on March 18th, 2022, our family was in the Oval Office standing with the President of the United States, watching him sign this law. And that was an incredible moment because it wasn't just obviously a celebration of that singular moment. It was really a celebration, if you will, of all of that work and that really high degree of collaboration. But more important than a celebration, it was a recognition to the millions of health workers we have in the United States that they are valued, they are supported, and that we are there to help them. And so it was something I hope to never forget. It was very memorable.
Such a big moment.
Yeah.
Especially since, I mean, obviously Democrats, Republicans, people can argue about bills and everything. Like, it's so cool. And I'm glad that everyone worked together to get it passed so quickly. And gosh, like you said, it's not just that one moment you guys were in the Oval Office, but the past I can't imagine what the 24 months before that looked like. Just probably so much moving parts, so much stuff going on. And finally to be there with that bill getting signed by the president, that must have just felt like unreal almost, and you and your wife are both lawyers. So that was probably, that's so cool that you guys are doing something so impactful with your law degrees.
Thank you. Yeah.
That's beautiful. I love it. So that's
Thanks.
crazy. How would you say, like, so you have 2 kids. How did having 2 kids did that make it harder to get a lot of this stuff done? Or, are you like on the road a lot? Are you moving around?
It's a great question.
Yeah.
So, both my son and my daughter were very, very close to my sister-in-law who died. And my wife was also very, very close to her big sister. And so, there's kind of two answers to that question. The first is, when a family experiences a suicide, it is devastating and really deeply devastating on a lot of different levels. And so beginning the foundation right after my sister-in-law died is not something that I would recommend to any other families who have had a suicide. We did it because we were, thrust into the national spotlight against our will. Lorna's story was put out there over our objection. We wanted it to be quiet. We didn't want anybody to know about it. We were burdened by the same, stigma that many others are. And once it was out there, I felt like it was important to keep the story in the news as long as we could keep it in the news, because we were hearing from so many health workers. And I wanted to make sure that the country was paying attention to our health workers, particularly during COVID. So it was very hard for our kids to hear us, mom and dad on national news all the time. And we've got the 60 Minutes crew in 1 minute. We got CNN another minute. We got the Today Show another minute. We've got reporters from the New York Times and Vanity Fair and all of these major publications wanting a piece of our time. We're getting called by the governor of Virginia. We're getting called by our state senators. It was very intrusive and at a time when it was really hard. On top of that, then we're taken away for some travel and speaking engagements. But I think that it was hardest on our family to keep speaking about this moment that my sister-in-law died. And so as quickly as I was able to, and it took years to do this, we've changed the conversation, hopefully, so that we don't spend most of our time talking about my sister-in-law's suicide. We spend our time talking about the needs of our healthcare workforce and the impact that we can all have to make their lives better so that they can simply do their jobs and take care of patients.
And so in that moment is probably when you guys realized that it was, so much bigger than just like something small happening. Like, this is nationwide, that health workers are going through a lot of stress and so much stuff. That's when you guys realized, like, this is, although the timing wasn't great, that it was like, it almost panned out like good, in a sense that you guys, what you've created in the past 5 years.
Yeah, we certainly would never have picked this journey. If you think about, sometimes when you start a business, and it's a nonprofit organization, but a nonprofit organization is a business, you have to have, your business case, but then also timing is really important to what you're doing. When we began the Lorna Breen Foundation, it was a time, particularly at the beginning of the pandemic, when people were banging pots and pans and really celebrating healthcare workers as heroes, which is one of the reasons why we put the word heroes in the name of the foundation. It now has negative connotations. So we are more likely than not going to take that out of the name of the foundation, because we want these health workers to be viewed first as humans before they're viewed as heroes. But the timing was really important. And I think people, for the first time in a long time, I should say, like the general population, picked their heads up. Policymakers picked their heads up and said, oh my gosh, there's not a separate like public health workforce that's kind of sitting in the wings that is going to deploy and take care of all of us in a pandemic. It's all the same doctors and nurses we have. And if we don't have them, then we don't have anybody to take care of the country. And so I think that it was this spotlight that was shined on the workforce. And we came in to say, we need to be extra careful right now more than ever, because there are all of these mental health challenges that health workers are experiencing. And I want to pick up something that you said before. As you're not in healthcare, I wasn't a healthcare clinician either in my career, but it's very predictable that in just the normal, take a pandemic and put it in the parking lot for a minute. In the normal career of a nurse, a doctor, a dentist, a pharmacist, you're going to see some things that will be that will impact your mental health. They will be traumatic. They will be incredibly stressful. And yet, what I've learned is there are very few organizations, in educational organizations, medical schools, nursing schools, dental schools, pharmacy schools, that are training their future health workers how to deal with kind of the known stuff that they're going to see, the bad stuff, the stressful stuff. And so part of one of the things that we're kind of trying to change the conversation on is we all need to look at this differently, embrace the fact that health workers are going to experience a high level of trauma and stress in their jobs. Let's prepare them to handle it in a way that is appropriate so that they can take care of themselves and keep their career. There's a national health workforce shortage right now in the country. We have tons of health workers that are leaving in droves, and they're doing it because the workplace conditions are too stressful. And so we need to not just prepare them for that, but then we also need to retrain healthcare leaders on how to change the way that organizations are run so that the workers are simply able to do their job. It's a simple concept, right? It's harder to execute, but that's a lot of what we're doing at the foundation.
So there is actually a shortage going on with healthcare workers right now.
There's a huge national shortage. Hundreds of thousands of nurses have left the profession in the last few years. And we get contacted all the time and by healthcare workers who are like, I can't do it anymore. There's early retirements of doctors, early retirements of nurses. And again, it's because of it's not usually because of money. It's because their burnout is through the roof. About 2 years ago, the Centers for Disease Control declared a national health workforce mental health crisis. And it said health workers, and it compared those health workers to every other job sector in the United States, even guys that own pizza places, right? And it said the mental health of health workers in the United States is the worst of any other profession.
Gosh.
And it said there's three big things. About half of them are burnt out, and I can talk about what that's really about in a second. About half of them intend to leave. About 50% intend to leave. And then there's a huge increase in threats and violence against health workers in the United States. And so when you kind of look at that landscape, if you have a career choice to make, am I going to go into this or not? Or am I going to pivot away from it or stick it out? A lot of people are making a choice to do something different.
I mean, just hearing the three things you said, I mean, that's like, I would be like, what the heck? Like,
why would you do it?
Yeah.
Right. But we need it.
It's crucial. Yeah.
And people are called to do it. I mean, I know so many doctors in the United States whose children go to medical school. I know so many nurses in the United States whose children go to nursing school. And, when you're in your late teens, early 20s and making that decision, you have yet to, you see, I want to go help people. I want to go take care of patients. But what you don't experience is what it really is like to do that. And when you look at the fact that in the United States, 1/3 of nurses, 1/3 of them, leave nursing entirely after just practicing for 2 years. So you've just gone to undergraduate school, you've gotten your nursing degree.
Finally got a job and...
You got a job.
2 years is...
1/3 of them just are like, you know what?
Can't do
this. This is not what I signed up for. And so again, you kind of have to look at it. And for me, with my business school training, I look at what is the root cause of the problem and how can we get upstream of a problem as opposed to keep putting Band-Aids on the problem.
Yeah.
How can we address it at the source of the problem? And so that's the biggest thing. And what we've done at the foundation is we've really tried to help create a starter kit for healthcare leaders so that they can get at the root cause of the issues, make the day-to-day experience for health workers better so they stay. And that's kind of what we do at the foundation.
Corey, do you think a big problem with that, like why 1/3 of nurses are leaving 2 years into their job, Do you think a big problem is that maybe some of the hospitals are understaffed and like these nurses are running around, maybe working overtime on top of seeing everything they're seeing, or just being worked like crazy? Is that a problem you guys see?
Yeah, one of the biggest things that drives health workers of all types to burn out is the amount of non-patient care work that they do that's paperwork. I was recently reading a post by a doctor who said, my shift ended at midnight. I was here till 3 o'clock in the morning working, filling out paperwork. And then I had to be back at 7 a.m. for my next shift.
Yeah, that's crazy.
And so same kind of thing for nurses, same kind of thing for doctors. What you look at is about 50%, about half the time that a nurse spends on the job, on a shift, they're spending away from the bedside in paperwork. A primary care doctor is spending about 70% of her or his time away from the patients and working on paperwork. And so I have been provocative in kind of the healthcare industry by saying, we don't have a health workforce shortage. We have the only clinically trained workforce in the United States spending their time doing paperwork over patients. And so those are some of the things that we're training healthcare leaders on how to fix at the foundation. That doesn't sound real mental health, does it? That's like healthcare operations.
Yeah.
But that's what's driving the burnout in the first place. So
what are some of the solutions like to cut that from 70% to maybe they're only using 5 or 10% at that time and they're spending 85, 90% with the patients?
Well, we run groups of hospitals in state-based groups of hospitals. Right now we're doing it in Virginia, North Carolina, New Jersey, and Wisconsin. And what they do is they take a topic that they're trying to fix. And one of the biggest drivers of this is the electronic medical record. It has in it a lot of very inefficient steps that keep those workers on the job longer than their shift, and during their shift away from patients. And so there are a number of tools that have come out. Some of them are AI driven.
I was going to ask that because I mean, why not, right?
Why not? But what you find in healthcare is some of these solutions don't scale across even one hospital system very quickly. They'll start it as a pilot project in one area, but then it won't scale it. But when we look at the solutions that are around the electronic health record, there's a great opportunity to just simply kind of roll your sleeves up and dig into areas to make it more streamlined. But one of the things that we talk about in all of this is the most important thing for leaders to do is to just open their ears and ask the workforce, what is it during your day-to-day that is taking you away from patients? I recently had a nurse who told me, she said, Corey, my boss asks me every day about my burnout and directs me to our yoga, our meditation, our employee assistance program. And she keeps saying I need to take care of myself. What I need her to do, though, is I need her to listen to what I'm saying about the things that are getting between me and my patients every day. That training about how leaders come to work and listen and take that feedback from their workforce and then do something different, that's a lot of what we're doing at the Lorna Breen Foundation. And those are the kind of things which make a huge difference in the day-to-day lives of healthcare workers.
Yeah, like I actually asked them, because, what's causing that burnout? Because, it might be nice to go do the yoga and stuff too, but it's like tomorrow you got to come back and do the exact same thing. Like, how much is the yoga really going to help?
That's exactly right.
That's really
exactly
cool.
Right. We just got a time check from your buddy. So I don't know if you want to.
Yeah, we can call it. Thank you so much for coming on, man. I think that was super cool. I think we got 45-minute segment going. So really appreciate your time, Corey.
It's my pleasure to be here. Good luck with the podcast. It's an honor to be one of your first guests.
Thank you so much.
And you're doing great work here. So
maybe we'll get a part 2 when you guys come back down to Florida.
Happy to do it. We'll
Sweet,
be thrilled.
man. Thank you so much.
You got it.
I really appreciate it.
Yeah, you got it.